Ulcers can sometimes be a real nuisance after gastric bypass surgery. In this video, I will discuss the use of anti-inflammatory medications and bariatric surgery and how to avoid ulcers. Hi, I'm Dr. Stephen Kelly, Bariatric Surgeon, Christchurch, New Zealand. Although gastric bypass is an excellent operation with excellent results, about 5% of people with this operation will develop stomach ulcers. This is because the gastric bypass is sensitive to forming ulcers compared to the sleeve gastrectomy, which is relatively resistant to ulcers. With gastric bypass, the ulcers usually form at the joint between the stomach pouch and the connected small bowel. This is because the acid secreted by the stomach erodes the sensitive lining of the small bowel. Stomach ulcers can cause abdominal pain and sometimes cause bleeding or strictures. There are three main risk factors for ulcers: anti-inflammatories, otherwise known as non-steroidal anti-inflammatories, brands such as ibuprofen or Voltaren. The other risk factor is smoking, and if you smoke, that increases your risk of the development of stomach ulcers 5 times. The third risk factor is a bacteria that can live in the stomach called Helicobacter pylori. Ulcers are diagnosed using a flexible scope called a gastroscopy. The treatment or prevention involves avoiding the risk factors. So firstly, avoiding anti-inflammatories if possible. Never smoking if you've had a gastric bypass. And if there is the bacteria in your stomach, it can be treated and eradicated with antibiotics. The important question, of course, is can I take anti-inflammatories after bariatric surgery? Many people having bariatric surgery need them for chronic painful joint conditions or back pain. It is proven that anti-inflammatories given around the time of surgery are very useful and proven safe. They also reduce the amount of morphine required after surgery, which is a very good thing. It has been shown that anti-inflammatories taken after gastric bypass for a short period, that is less than 30 days, is safe and don't lead to problems. Ulcer risk increases with longer-term chronic use beyond 30 days. Taking anti-inflammatories after bariatric surgery is all about the risk versus the benefits. If you need to take them, they should be taken in the minimum effective dose and also taken with an acid-reducing medication like omeprazole, and this is to protect the stomach at the same time. Another protective option is to take a less ulcer-forming anti-inflammatory like celecoxib. If you are diagnosed with an ulcer after gastric bypass, the treatment is high-dose omeprazole capsules taken twice a day. The recommendation now is that you twist open the capsules and mix the contents with food. One study shows that if you open the capsule and take it that way, your ulcer will be healed in 3 months. If you swallow the capsules whole, it will take 11 months for the ulcer to heal. At the same time, you will also take sucralfate. These tablets must be dissolved in water before you take them 3 times a day. They coat and protect the ulcer, which also helps the omeprazole heal the ulcer. To prevent ulcers after gastric bypass, your surgeon will recommend at least 3 months of omeprazole after surgery. 6 weeks after sleeve gastrectomy, ulcers are not really a problem, so you can take anti-inflammatories as you would normally. The first 3 months after surgery is an exciting time. The weight drops off very quickly, the joint pains quickly improve, so that many people find they don't need anti-inflammatories.